Welcome to our MyIBD Learning virtual program, IBD Accommodations in School. My name is Sanvi Gupte. Children with inflammatory bowel disease go through many ups and downs that may impact their academic performance and school attendance. Tonight, you'll hear from a variety of perspectives to help you better understand what accommodations could be available, tips for navigating the school system, and how to assist your child in utilizing these accommodations. In order to make the program more interactive and find out how much you've learned tonight, we'll be asking 2 questions via poll on your screen now. Let's start with tonight's first question. Which of the following is false regarding 504 plans? Let us know what you think and pick the answer you think is correct. Directly underneath, you'll find our second question, true or false, your child's high school 504 plan transfers over to colleges/universities. I'll give everyone a few seconds to make their selections. At the end of the presentation, we'll ask these questions again and see how much the group has learned. Thank you for your participation. It looks like most people selected an IEP is the same as a 504 plan for the question 1 and false for question 2. Let's listen in to the following presentation to learn more. On behalf of the Crohn's and Colitis Foundation, thank you all for joining. The information shared is meant to be for educational purposes only and should not replace any advice or guidance from your own healthcare professional. The program will be recorded and posted on the MyIBD Learning website, www.crohnscolitisfoundation.org/MyIBD Learning, and everyone who registered for the program will receive a link with the recording next week. We want this to be as interactive and engaging for you, so we encourage you to submit your questions through the Q&A box, which can be found at the lower part of your screen. Following our expert discussions, I'll moderate a Q&A session with all of our panelists and will address as many questions as we can at the time. Tonight, we have the opportunity to hear from 4 speakers. Our first presenter will be Maggie Murray. Maggie Murray is a licensed professional clinical counselor and a school-based mental health therapist in Minnesota. Maggie has worked in school settings for the past 6 years and has been a school-based therapist since 2020. Part of Maggie's job includes working with school counselors and school social workers to help advocate for student accommodations. Maggie's currently working in a kindergarten through 8th grade school in Minneapolis. Maggie also volunteers at a CCF's Camp Oasis as a lead mental health specialist. Next, we'll hear from Leah Hirsch. She's currently a bit touch and go, so once we reach her presentation, if she's not able to speak, I will speak on her behalf. Leah Cohen Hirsch resides in Fairfax, Virginia, outside of Washington, D.C., and has 3 kids with chronic conditions. Her oldest was diagnosed at 4 years old with Crohn's, now 14 years old, and one of her twin boys has psoriasis and ADHD, while the other one has KCNMA1, a rare genetic mutation, and epilepsy. These conditions are a part of her kids' lives, but do not define them. Besides advocating for her children's healthcare needs and educational accommodations, Leah is a healthcare executive and a patient advocate. Outside of work and her family, Leah enjoys working out, baking, and helping the community. Following Leah, we'll welcome Debbie Anderson. Debbie Anderson has worked as an educator since 1987, including teaching in the early childhood and elementary school classrooms, as well as the college classroom at Indiana University Bloomington and Ivy Tech Community College. Debbie has been in a current role as an access coordinator for the last 8 years at the Indiana University Bloomington Accessible Educational Services, supporting students with accessibility measures, accommodations, in the college classroom, and providing support to instructors. To close our presentation, I'll be providing my personal perspective. I'm a rising senior at the University of North Carolina at Chapel Hill, majoring in chemistry. I plan on attending pharmacy school next fall in hopes of becoming a clinical pharmacist. I was diagnosed with ulcerative colitis in June 2020 during my senior year of high school. I joined the Foundation's National Council of College Leaders in 2021 and currently serve as the Communications Workgroup Chair. I'm currently working as a research assistant in a lab at UNC School of Medicine, where we're actually working on IBD research, which I think is pretty cool. There are no disclosures for our presenters tonight. Now, let's get started with tonight's presentation on IBD accommodations in school. At this time, I'd like to welcome our first presenter, Maggie Murray.
Hi, so I'm Maggie. I am a school-based therapist in a K through 8 setting, and I'm here to talk to you guys about the primary school accommodations that you could have for your child or your student. So these accommodations can include things like unrestricted access to the bathroom. So this can look like not having to ask your child's teacher to go to the bathroom and just going to the bathroom so that it's a little bit more discreet. Or as you get older and you might have like hallway passes, that you have unlimited passes to go to the bathroom. Access to a private bathroom, like in the nurse's office, so that can help with some like embarrassment or frequency. And then preferred seating in the classroom near the exit, like I talked about, so that there's a little bit of discreetness to that. They can leave and come back without making a big disruption. Allowing breaks during the day where they can lay in like the nurse's bed down there and take a break, and access to bathrooms during testing. So this is one that we see frequently just because a lot of like standardized tests, both at state level or like as your child or a student grows to take like the SAT or the ACT, they do not allow bathroom breaks. So having it written down that your child can go to the bathroom during these tests can be beneficial. My number one tip is to talk with your student's healthcare provider or school nurse and their teachers. So if you can advocate on behalf of your child and tell them about what's happening, most times they're really willing and able to help make some of these accommodations happen, and even without a 405 plan. So I'll talk about the 405 plan in the next slide, but there's a lot that the nurse and your teachers can do before having to get a 405 plan if you ask and advocate, and just so that they know what's going on, because they might not until you tell them. And it's better to be kind of out in front of it and tell them before so that they know and they can help get these in place before it's really necessary or really dire, right? Like your student is really needing to go to the bathroom and is being refused by their classroom teacher. So if you want to go to the next slide. So the 405 plan, a 405 plan is a legally binding document that allows your student to have certain accommodations relating to their illness. So a 405 plan puts in writing these accommodations so that school staff cannot legally refuse to follow them. So if your child has a 405 plan or your student has a 405 plan that says that they have unrestricted access to the bathroom due to a chronic illness, then your child's or student's teacher could not refuse to allow them to go to the bathroom. So I'm not saying this never ever happens, right? Like that a teacher has never refused accommodation, but legally they cannot. So then they could be in violation of the 405 plan and get into some legal trouble with your school district or whoever the body of, like whoever's governing your school. So that's one thing that can be really vital to having a 405 plan, is so that they cannot refuse it, right? Because if you go to your student's teacher or nurse at the beginning of the year and you're saying, this is what's happening with my student and we want to have unrestricted access or preferred seating, your child's teacher or your student's teacher could say yes in a moment. And then when standardized testing comes or when there's a big test, then they might say, you can't actually go to the bathroom. I want you to finish your test. Where a 405 plan has some of these accommodations written into their plan so that they cannot legally refuse it. A 405 plan is reviewed annually and is not an IEP. So an IEP is an Individualized Education Program. That's where your student would go through testing and have certain things identifiable that would put them in special education. A 405 plan is just accommodations to help with like chronic illnesses or mental health illnesses, things like that. So it's not special education, which sometimes people get confused. It varies who the point person is for the 405 plan. So at my previous school, it was our school counselor. My current school, it's the social workers there. So you can ask your student's teacher who to get in contact with. And then there's also a sample 405 plan. Oh gosh, am I saying it wrong? It's a 405 plan. Sorry. Oh my gosh, did I just say it again? A 504 plan. Geez Louise, sorry. A 504 plan. Sorry, everyone. There's a sample 504 plan on the foundation website that's specifically for IBD, which is really, they have like almost every accommodation you could think of for your student. And so that's a really good place to start. If you're like, I think I might want to go down this avenue, they have a really awesome sample 504 plan, specifically for children and adolescents with IBD. Sorry about that, everyone. Yeah, 504, as on the slides. Don't listen to the numbers coming out of my mouth. Perfect. That's my couple of slides.
Thank you, Maggie, for your presentation. Now I'd like to welcome our parent perspective, Leah Hirsch.
Hi, and good evening. And I just want to apologize for the background noise. I have 2 kids who have been hit by the plague of pneumonia this summer. So let's get started quickly. So as I said, was said in my intro, my daughter was diagnosed at 4 and is now going to be a freshman in high school. So I have dealt with this from the beginning of her education. And over the years, I've learned some tips that I just wanted to share with other parents because I found them to be very helpful. So the first thing is that you need to be an advocate and you need to teach your kids to be an advocate. You are your kid's advocate. No one else, knows what your kid is going through, has been on the journey with you or your kid. So you need to speak on behalf of your kid. As a parent, we need to lead and guide the process for our kids. They are our number one priority. And the school, whatever is necessary for them, the school needs to figure out how to accommodate. That is not our responsibility as parents to figure out the resources and the funding in order to get those needs met. The other thing to really think about is when you are not at school, like your kid needs to learn to advocate for themselves. As Maggie was describing before, there are teachers out there that have not reviewed the 504. I've learned, as was previously said, I have 3 kids with chronic conditions and 2 have IEPs and 1 has a 504. And I have seen with all 3 of them, teachers who have not reviewed the 504 or the IEPs. So you really have to be aware and make your kids aware of what the accommodations are within their 504 IEP as necessary for your kid. One major example is my daughter knows she has, like Maggie said, open access to the bathroom, and she had a teacher who was restricting her access to the bathroom. And my daughter successfully advocated on her behalf that it was in her 504, and leadership from the school got involved. And, the teacher admitted that my daughter was correct. And then I think the other thing is that as an advocate and in teaching your kids to be an advocate is you have to realize that the school may not want to provide certain resources for your kids because it may not be financially possible, or there may not be resources to accommodate those needs, but your kid may need them, right? And so they have to be providing them. So you really sometimes have to apply some pressure and not take no as an answer. These kids have a lot going on and they're really super resilient, and you want to try to make the best, accommodations for them as possible. The other thing is, tip that I want to provide is be proactive, right? These schools aren't going to come to you because they heard through the grapevine that your kid has a chronic condition, right? So you have to be proactive to let them know that your kid has these conditions and that you are needing support and accommodations for your kids. You need to keep your school informed if there's new issues, if there's been a flare that happens, or your kid needs to maybe go for colonoscopies. So all these things, it's best to have open and transparent communication with the schools and your teachers and others within the education community, because then they can work with you on the necessary accommodations for your kid. I think the bottom line that I have learned through this entire process is don't wait until it's too late and your kid is worse off, right? You don't want your kid in the hospital or at home because they're in a flare or something else like that. You want to take care of these situations immediately. And the more I've learned that the more upfront I am with her, like her teachers and the school about what's going on and what is happening in her life as far as her Crohn's is concerned, I've been more successful at keeping her healthy and keeping her anxiety and mental health as far as school is concerned stabilized. The third thing I want to state is that you need to be prepared, right? You need to know what accommodations your kids want. Maggie gave a list of great examples, but like not all of them apply to each kid, right? I am part of a text chain of moms that all of our kids have Crohn's. All of our kids have different accommodations, right? And all of our kids need different things to get through the day. And so, but you need to really know what your kid wants and needs. And the other thing is when you go in and you have to be prepared is you have to think about, do I want to get the kitchen sink of accommodations or do I want to get specific accommodations and then come back if I feel like it's necessary, if we're seeing something that we might need. I think it depends on the district and how you want to handle that. Most times I ask for the kitchen sink with the kids, but for example, with her transitioning into high school, I don't really know what the high school setting is going to be like and what her needs are going to be. So I've kept the standard from middle school to go into high school. And then we'll see, as I have kept the door open with the high school folks to make sure that we can have communications early on in the year if additional accommodations are necessary. And if you're sitting there and you're like, I don't even know what accommodations I should potentially ask for, I think the Crohn's and Colitis Foundation has a ton of resources on their website. You can also talk to like several different parents groups on social media. I think there's parents out there who are willing to help and support. I know I am always supporting these other moms on my text chain as far as like, what the thoughts are and how to navigate school situations. And we're, a team throughout like this education process with our kids. I think fourth, you really need to be open with your kid, right? You need to talk to your kid about what accommodations they want, right? And you need to talk to your kid that this is something they're battling every day and they're going to have to face in the classroom, right? And I know some kids don't want to be embarrassed or they don't want to be singled out for certain situations. So it's really talking through with your kid, like, what do they want and how do they want to see this accommodation, right? And what's going to be the best situation for them. Obviously not to abuse the situation or potential accommodation, but really be open with them. And I think it's also really important to talk to your kid about ideas that you may not have suggested. Like they may have ideas that they've read or, I know my daughter's on several different social media sites with other kids with like Crohn's. And so like she hears other different things and is like, we'll have a conversation. Is this something that is necessary for her or is it, pushing the envelope a little bit? And I think lastly, you have to be extremely supportive of your kids, right? There is no stigma with having a 504. I am shocked nowadays with the number of kids that have 504s and the number of kids that have IEPs, right? So there should be no stigma whatsoever attached to that. And there should be no stigma attached to needing accommodations because as I see more and more with friends' kids and around the community, kids are having accommodations for a variety of different reasons. It may not be an IBD situation, but it may be something else. And I think it's really important that we destigmatize all of that for them. Okay, next slide. So as I said, my daughter's current 504 accommodations are rather simple. She has standardized testing only in the morning. Like probably most kids, she wakes up rather early to use the bathroom. And so it's best that she does her standardized testing and core classes in the morning when she's most alert and able to pay attention to those. She does have open access to restrooms and then emergency access to bathrooms if it's going to be she feels like it's going to take longer. So she'll go in the nurse's office or a staff bathroom. And then she has access to water bottles and refills without any restrictions. Okay, and then some other accommodations. I asked, my other mom friends, like some other accommodations that some kids have. And, this isn't an exhaustive list, but this is what some of their kids have. And so they have the ability to chew gum or mints in class as needed, extended time on completing assignments without penalties if they're sick or not feeling well, or they have to leave school early. Breaks during physical activities as necessary, depending upon how they're feeling. Days off for medical appointments or illnesses are seen as excused absence, even if they don't have a doctor's appointment. They also have excessive extra lunchtime because sometimes, just like any of us adults, it's hard to eat your meal in like 12 minutes and like scarf it all down. And so they just have to let it process a little bit more. And then access to safe snacks, right? Some of these kids really just need to like sometimes have a snack or some sort of drink to just calm the nerves down. And just lastly, I just wanted to, make the point that, there's clinical components of Crohn's that are really important. And I think our doctors are taking care of that. But I think it's really important as parents that we focus on our kids' mental health. I think there's a lot of anxiety and pressure that, kids feel when it comes to school. And this can impact their IBDs. I know my daughter, like when her anxiety is high and she's feeling the pressure, that's when she's like at her worst, right? And we start to see signs of her Crohn's, emerging. And so I think it's our job to work with the school, be our kids' advocate, and support our kids so that we can identify and get them the necessary accommodations to lessen that anxiety and pressure that comes along with going to school on a day-to-day basis.
Thank you, Leah. It's great to hear how you were able to support your daughter throughout her IBD journey. Let's switch gears a little to accommodations at the collegiate level. Let's welcome Debbie Anderson.
Hi, good evening. So I'm an access coordinator at IU Bloomington, and Bloomington is the main campus for the IU system. IU at Bloomington is very large. We have a total enrollment of approximately 49,000 students now. That includes undergraduates and graduate students. We serve both populations, undergraduates and graduates. And our office is actually one of the largest in the Big Ten for serving students as far as the number of students, I'll say. Soon we're adding more access coordinators, so we're very excited about that. We have nearly 4,000 students that we're working with. So also something to know that's important is that colleges and universities strive to be consistent in accessibility measure or accommodation implementation. But there are guidelines and procedures per institution that may vary based on the size of the institution, student population, and other factors. So for instance, IU Bloomington might have some different policies, a little bit different than maybe IU Indy or IU Kokomo and so on. You'll find that for different colleges and universities. So I've already used some terminology that's a little bit different than the norm. So for one, in July 2023, Indiana University renamed the offices which provide accommodation support to students at IU Bloomington and the other satellite campus offices to one common name, Assessible Educational Services, or AES. That was very helpful for our students because some students take classes at the satellite campuses for online classes. Also, with the office name change, our office at IU Bloomington has made some terminology changes. This first one has been very popular. We are using the term qualifying medical condition, and in printed materials, we'll say under the Americans with Disabilities Act, or ADA, and we use that instead of disability. Our former office name was Disability Services for Students. So you'll find that as a common name for offices that serve students for accommodations at the college level. But a lot of offices are seeing kind of a paradigm shift in the name because some students don't identify of having a disability. And so we're finding that students are seeking us out a little bit more now. So we're probably going to grow even more for the number of students we serve. So also the term accessibility measures, we are pairing that with accommodations. So you're going to see that used in my presentation kind of interchangeably. And the reason is the switch is that accessibility measures are defined as to make accessible, whereas accommodations are defined to modify. At this level, we're really hoping that professors would be faculty, could be graduate student instructors, all the way to full professors. We're hoping that they will, look at making their classes more accessible. And there are some laws related to that as well, that you'll be hearing about for vision and hearing in the next year. So our mission here at IU Bloomington Assessible Educational Services is to provide students with qualifying medical conditions under the Americans with Disabilities Act, also known as ADA, with resources and supports to allow equal access and reasonable accessibility measures or accommodations to fully participate in university life. As I mentioned, this includes graduate students. Some key words here. Equal access, also reasonable accessibility measures. There is a difference between preschool through grade 12 and the college level. Preschool through grade 12, is free public education where students have a right to the accessibility measures. At this level, it becomes we're looking at what is reasonable for the students at this level working in this environment. So our role is to determine classroom and testing accessibility measures. We work to provide support to students and faculty in implementing accessibility measures. We provide what we call collegiate life coaching support, or CLIC. That's with students. We work on time management, organization, other success strategies, such as study skills, troubleshooting in general, and so on. We make referrals to campus and community resources, and that might include like Indiana University Health, also known as IU Health. The hospital is now on the IU campus, so several students that might have flare-ups are able to go to the hospital very quickly. It's within about a mile to 2 miles, depending on where you are on campus. Also, we offer assistance for temporary impairments, such as concussions, broken limbs, surgery, etc. We provide education and outreach to the university community, and we address campus accessibility issues. There are some common accessibility measures for chronic health conditions, and that IBD falls in the chronic health condition area. So flexible absence is extremely important for students to have, usually because of flare-ups that might happen. That is an accessibility measure that we can approve by having the interactive process with the student and the supporting documentation that shows the need. That is something that professors, though, will determine how they implement it, because they have to make sure a student is proficient in the content before they, give the grades. So flexible absence would include typically some extra excused absences. Indiana University and a lot of colleges have a suggested number of absences. IU Bloomington is that students should miss no more than 20% of a class. Of course, professors, again, determine their course requirements. And then there's also a couple of components where students would work with professors if they miss an exam due to a flare-up. Also, they might have some assignment extensions if they've had a flare-up related to an absence. With this, we also have a lot of students that have a need for testing accessibility measures like extended time, distraction reduced setting for assessments, or stop the clock breaks. So also there's classroom accessibility measures. like for instance, laptop with recording permission to take notes. You know, a lot of time there might be concentration challenges, blocking, you know, students with being able to concentrate. So also there might be an option for students to use volunteer peer notes, preferential seating, like in the lower levels and elementary on through high school. That's important too, so a student can have the ability to leave the class. And that is something that they would discuss with the professor whenever they meet with them. Also, having the ability to eat and drink, that's very important to have access. Transportation might be a possibility, a need for some students. We are a very hilly campus at the IU Bloomington campus. You will find varying types of campuses. So that might be something to consider when your student goes on to college. We do have a couple vans that are able to transport students on campus. So some tips for requesting services. It's good to know that, you know, requesting services is confidential. Sometimes students don't want others to know that they're working with the office that gives accommodations at the college level. And so you can guarantee them that this is something that stays between them and they're in the office that they're working with. It could be helpful for them to share some information with others, such as an academic advisor. Students at this level can share as much or as little as they'd like. Advisors can be helpful because they're guiding students through their program. And in order to make sure that they're getting, you know, the correct classes, the best classes possible for their challenges, then it could be helpful for them to know at least something related to strengths and challenges. We at IU Bloomington, we don't share a diagnosis, but a student, if they want to, they may. So that's up to them. Also, with the processes, as I mentioned, it's going to differ between colleges or universities. So it's important to work with your student, your college student, and they'll be in high school when they're looking at this usually. Review the University Accommodation Office's website for steps to request services. You want to do that in a timely manner, you know, because they'll be going on to college. Possibly some students might start in the summer, depending on the program they're in. And then, so you want to make sure they're registering for services by that winter or spring, so that way they can get the accessible measures or accommodations implemented right away. Some will be incoming fall freshmen, and those students need to register usually early spring or summer. I will mention here that with accessible measures or accommodations, those should be implemented any time of the year. The challenge is that professors have 10 to 14 calendar days to implement accommodations. So that is under Office of Civil Rights. They have rights too, because they have to be able to set up the accommodations, and they do that in meetings typically. So that's something to help your student to be able to help them plan ahead and be proactive. I will also mention that offices, staff are usually very helpful, you know, to call the office of the colleges that you're exploring with your student, so that they can answer questions. So a few more tips is that typically students will need to submit current diagnostic documentation. For our health conditions, we have a few different types of health conditions that we ask for documentations on a form. Like IBD would be on the chronic health conditions form. Now students can also submit like a comparable letter from the doctor. It does need to be current, and that's usually within the last year for our guidelines here. And that's something you would want to explore, whatever university or college your student is going to. There's some information about IEPs and 504 plans. There was a question that we asked earlier on. They actually do end when students graduate from high school. A lot of students, parents, and even teachers don't realize that. What happens at the college level is that colleges and universities function under the 504 laws. That's why we are implementing accommodations at this level. And so high school documents could be helpful though. So it could be helpful to go ahead and submit it, even if it doesn't fully meet the guidelines for that office, because it might help with approving placement test accommodations and also regular year accommodations. There might be some input that was on that form that could be helpful. So also, students are usually assigned a coordinator. They're going to be called different things. Our old title was disability coordinator. I am very happy with my new title as access coordinator. And so, I help provide access here at the college level. So you'll want to work with your student to make sure they're following up with their coordinator. By what they do is they use the college university email. And that's something students forget. They might want to provide their personal email, Gmail, whatever, but then they're missing a lot of information typically if that's what they do. So if they follow up with the university email, they'll be able to catch whenever the coordinator reaches out, if they have questions about the documentation, or if the student is ready for the next step, which usually is a type of accommodation orientation that will vary depending on the process for the college or university. So this is something that might be a little bit different, especially as you've been part of the process all the way from preschool through college. And I have my own 3. I have 2 that have worked with our office. And so the discussion, also known as the interactive process, with the access coordinator or the coordinator at the office for accommodation support at the college, is really between the student and that coordinator, because we want to be able to give the student the ability to talk about their needs, their challenges, and see what would work with, within the guidelines for that college accommodations office. And parents and guardians can usually be involved in that conversation a little bit, but we really want to, empower the students, and that's a typical type of way that accommodations are implemented at the college level. So, thank you.
Thank you all for your wonderful presentations. I'd like to go ahead and share a piece of my IBD journey. So I was diagnosed with UC during my senior year in high school. As I was applying to colleges, I now had to also consider how my chronic illness would impact my decision on which university to attend. The prospect of college is already a very daunting thing, and managing IBD just kind of added it to my anxiety. So to make that transition smoother, I researched the accessibilities of the schools that I was interested in to kind of determine which school would be the best fit for my needs. A quick Google search can just get you the disability services office for every school you're interested in. There I found the standard accommodations that they offered. And if they didn't have something that I thought I needed, I would reach out to them. I just send them an email and ask them if it's something that they think they could give me. In my experience, most offices are open to answering questions. They want to help ease your concerns before you commit to a university. Once I chose a university, I got in touch with the office right away. The general process for receiving accommodations, it may vary slightly for your school, but it typically involves registering with the office online, providing necessary documentation from your healthcare provider, meeting with a disability services representative, and then notifying your professors and the testing center of your accommodations. When you meet with your provider, I highly suggest discussing what accommodations that they think would be beneficial for you. That way you go into your meeting with the disability office prepared. So this is a list of all the different accommodations that I currently have. I've had to use my accommodations a variety of times throughout the years. My most frequently used accommodations include stop the clock testing, which allows up to 30 minutes for breaks. Excused absences and extended deadlines are also extremely helpful, especially when I have a flare-up, infusion appointments, or just challenging health days in general. Priority registration is another key accommodation. Registering for classes can be a super challenging experience, and more often than not, you will not get an ideal schedule. So with priority registration, I could choose classes that fit my routine. So I have fatigue and I always take an afternoon nap. So I would schedule all my classes in the morning to deal with that. And then access to video recordings of missed classes. Some universities offer this, some don't, but it doesn't hurt to ask if this is an option for you. And then lastly, mobility services. It's not widely advertised, so it is something that you might have to ask about. But at my school, it's also super hilly, like Indiana University. So we have golf carts that you can schedule, pick up and drop off through an app, and then they transport me from my apartment to my class buildings. And this is super helpful for me because I have joint pain. And so when my joints are just hurting, I get to use this and go to class, and it's been really great. Each person's experience with accommodations can vary, and you might find yourself using them frequently or only occasionally, but having these options available can make a significant difference in managing your academic and health needs, and I really recommend them. So advocating for yourself is the most important thing you can do to ensure for a smooth semester. The first thing you're going to want to do is contact your professor. This process will vary from office to office, but most offices will provide a pre-written email that will say that you're registered with the office and then list your accommodations. It will not name your specific diagnosis or any medical details. That's completely up to you to disclose. And it's also up to you to send this email to your professors. If you don't send this email, your professors will not know you have accommodations. The next step is not something that's mandatory, but I found it to be super helpful. Schedule a meeting with your professor outside of class to discuss your accommodations and any other information that you're comfortable with sharing. That way you can share any concerns that you have about class, and it also allows your professor to get a clear understanding of your needs. Worst case, sometimes you might have to go to a third step where if you experience a problem in class or on campus, you should contact the people directly involved, including the Disability Services Office, as soon as possible. Talk about what the problem is and any adjustments that you think might help. And the Disability Services Office is there to help create new accommodations and advocate on your behalf. When I was a sophomore, I had a chemistry lab course with a strict attendance policy, which only allowed for 2 absences. And due to health issues, I had to miss more classes. And despite my accommodations, my professor insisted that I would automatically fail if I didn't attend class. So I reached out to the Disability Services Office and my professor, and we ended up compromising where I was able to do part of the class online so that I didn't fail the course. Advocating for yourself can be extremely scary, but it's extremely important for yourself, for your health, and for your grades. So I just want to provide a little reminder that always remember to give yourself grace and listen to your body. No assignment or exam is worth a flare, so don't be scared to use your accommodations when you need them, and advocate for yourself when necessary. Thank you all for listening to tonight's presentations. We hope that everyone learned a bit more about accommodations, navigating the school system, and how to be an advocate for yourself or your child. While we're gathering questions from the Q&A box, we'd like to resubmit the 2 questions from the beginning to see how much you've learned. At this time, please make your selection to the 2 questions on your screen. Again, the first question is, which of the following is false regarding 504 plans? And this is followed by our second question, true or false, your child's high school 504 plan transfers over to colleges/universities. This is great. The correct answer for our first question is an IEP. is the same as a 504 plan. An IEP is geared towards students who are in need of additional therapies, while a 504 plan focuses on accommodations for students that do not need specialized instruction. For our second question, the correct answer is false. In order to establish accommodations at the college level, students will need to contact the accommodations office of the school they attend or intend to attend. Thank you all for taking the time to participate in these polls. And now we can take some direct questions from our audience. If you have a question for Maggie, Leah, Debbie, or me, please type it in the Q&A box, which can be found at the lower part of your screen. Our first question is for Maggie. Do 504 plans apply to preschool as well, or is it just for public grade school?
Yeah, so you can have a 504 plan. Yep, I said it right. Okay, good. A 504 plan in preschool. 504 plans cover public school and then publicly funded private school.
And our second question is for Maggie and Debbie. Once you have a 504, can it be adjusted during the year?
Yeah, so you can have it, your child or your student's teacher or any school staff can initiate an update to the 504 plan. There just has to be some sort of noticeable change. So if you can like track your child's symptoms and say, this is where we started when we had the 504 plan, and now we're having increased bowel movements, increased whatever, then they can do it. So you can at any time change your 504 plan as long as there's been a change in the symptoms.
And at the college level, yes, we have update meetings as well. We call them currently accessibility update meetings, and where a student might work toward getting priority registration. That's a common accessibility measure that I did not mention. I'm glad you talked about that, Savi. That was great. And so yes, that is something that we do, is work on updating if needed. And we tell students that, you know, when we first meet for what we call the accessibility orientation, that is the beginning of our conversation about accessibility measures. And if we need to revisit, that is fine. We'll look at that again.
Great. And our next question is for Maggie and myself. Do 504s work outside the school day as well, such as before/after school music or athletic activities?
That's a good question. I'm not 100% sure because 504 plans are mainly for like academic reasons, those accommodations. So if you're self-selecting into activities, I'm not sure if it would follow. So that'd be a good thing to ask your school or the like faculty people that are providing those before and after school activities.
Yeah, I agree. In my experience, they don't extend to after school activities, but it is something that you could disclose if you wanted with whoever is coordinating the activity that you're a part of. And usually they will be accommodative to whatever you need. So I would just reach out to them if that is something that you're interested in. Then the next question is for myself and Debbie. Are there special living accommodations for college students who live in a dorm on campus, like your own bathroom?
So yes, that would be a housing accommodation. They have not changed their term. So with that, IU housing and other colleges have housing areas, you know, branches of the university that would work with students for housing accommodation request. That is something that you really want to be on top of, because like at IU, there's a deadline for students to have priority, and documentation is required. There's a form, students and medical providers fill out a form together here at IU. And IU Housing does work with students for other requests, you know, that are made after like the deadline. This has been May 1st, but it's just that priority goes first to the students that requested earlier.
Yep, I agree. For us, we have the option of either living in a dorm by yourself. That's something that you could ask for. Additionally, if not, you could ask to get the bathroom at least for yourself. But it's definitely something you could look into at your university. There will be something to accommodate for that. The next question I will be answering, what about when you're in a flare or experiencing symptoms that make it impossible for you to attend a college level program that's only held in person? Is there still a way to get an accommodation, or are you just not able to participate? This kind of goes back to the video recording option. If your university offers that, that is something that you could use. There are also a variety of online courses as well that are strictly online. I did that a lot my freshman year because I was flaring during that time. So that is definitely an option. You are still able to participate in college. You just have to disclose that with your disability office, and they will have options. Virtual classes may be a bit limited in options. There might not be as many as the in-person ones, so there is a limitation with that. But I think, again, just really advocating and seeing if there is another alternative for you, such as I believe Debbie also mentioned the note taker in class, things like that are also options for you to have.
Yeah, and I want to kind of piggyback on that. So IU was very, lenient about allowing some virtual classes, kind of like the pandemic time. They've kind of gone pre-pandemic in their requirements now that if a class is online, that they take the class online. If the class is in person, they really try to have the instructions stay in person. But again, it is good to advocate because some professors will work with students in different capacities. And then there was another question about that I just kind of went out of my head, so I may think of it. So, yeah.
Maggie, this question is for you if you are aware of this. What can school bus transportation professionals do to support these students? One member of our audience works in K-12 transportation industry and joined this to hear if there are things that we can all do as well.
Well, thank you for coming. That's such a kind and considerate way to look out for your students. I am not sure if there's anything directly in the transportation, like if you're on the actual bus that you could do. One thing that I can think of though is if a child is late to arrive to the bus, like after school, like if they're going to the bathroom prior to going on the bus, that you leave them or leave the school without them on there if you know that that's something that they might need to do to go to the bathroom prior to going onto the bus. But other than that, I'm not sure if maybe someone else has ideas on the panel too of ways that a transportation person can help.
I'm not sure I have any thoughts on that question, but that is, like Maggie said, a very sweet thing to do. We don't have any more questions, so if anyone on the panel has any last thoughts or anything that they would like to share, I think for me, it would just be advocating for yourself is the best thing that you can do. Just listening to your body, knowing your symptoms, and just even when you're faced with someone who tells you no, just keep persisting. It can be really hard, and sometimes you want to take that no, but just know there are people there to support you and a lot of people in your situation, and just keep advocating.
And I do see a question that was asked if we've seen a rise in IBD, and the question was, what do we think attributes to that rise? So I do work with many students with IBD conditions, and it probably has risen a little bit here. And we know, how much mental health is connected. And we know mental health has gone up in the rise of the need for accommodation support. So we see a lot of comorbidity between those two areas. So that is something that I could say, yes, we have seen somewhat of a rise.
As our program comes to an end, on behalf of the Crohn's and Colitis Foundation, we encourage you to keep learning about IBD and to visit our helpful educational resources. For more information on accommodations, talking to teachers and staff about IBD, and supporting your child, visit our Taking IBD to School webpage under the Youth and Parent Resources section of our website. A template Section 504 plan can also be found through this webpage. The IBD Help Center is there to provide information and resources to patients, caregivers, and healthcare providers about inflammatory bowel disease. They're available by phone or email, as well as live chat, currently available Monday, Tuesday, and Thursday. If you're looking to connect with other patients and caregivers, the foundation offers virtual and in-person support groups. The QR code at the bottom right of your screen will help you locate a support group near you. Finally, to watch previous webinars and expert conversations, please visit crohnscolitisfoundation.org/MyIBD Learning. I want to remind everyone to please fill out the evaluation survey that will be sent to you after tonight's program. We really appreciate the feedback, and it will help us plan future programming. Thank you to our expert presenters and to our IBD community for joining tonight. Have a great rest of your evening.